There are mainly three situations which will cause the axis deviation. One, there is movement of diaphragm. Two, there is overload of the ventricles. Three, there are conduction blocks. First, let's study about the diaphragm causes. Consider this hand as my diaphragm. This is our heart. Heart is attached to diaphragm at the inferior border. If the diaphragm moves up, heart is tilted towards the left side. If the diaphragm goes down, heart is tilted towards the right side. So when this diaphragm moves up, the diaphragm can goes up in physiological conditions such as expiration, or it can go up when the abdominal content increase, such as in pregnancy, or in pathological conditions. Pathological conditions such as ascites, that is fluid overload, or mass and obesity. And similarly, the diaphragm can move down during inspiration. Now the second cause, that is overload. Before going to overload, let us study about this electrical conduction. Here we will be having the AV node, and this is right bundle branch and this is left bundle branch. Right bundle branch will activate the right ventricle, left bundle branch will activate the left ventricle. So the resultant vector, this is the right heart is getting activated, this is the left heart getting activated. Left heart mass is more and it is more larger, so the resultant vector will be larger. So total resultant vector after adding these two will come little bit towards the left side. Okay. Now the overload. Left ventricle overload will cause left axis deviation because the left ventricular mass will be increased and the vector strength will increase, so it will cause left axis deviation. Similarly, right ventricular overload will cause right axis deviation. Left ventricular overload can be seen secondary to aortic stenosis or hypertension, and right ventricular overload can be seen secondary to pulmonary hypertension, COPD, interstitial lung disease, or obstructive sleep apnea. Now the third thing is blocks. In that, first is left bundle branch block. Whenever there is left bundle branch block, the right bundle branch will carry the electrical impulses. So first the right side of the heart will get activated and then it will transfer to left heart. So right heart will getting activated and then left heart getting activated. So the vector is from the right to left. So that will cause the left axis deviation. So wherever the direction of vector will be present, the deviation will be that side. But remember, the right bundle branch block alone will never cause the right axis deviation, because whenever there is right bundle branch block, left bundle branch will be sending the impulses. Left ventricle first will be vector producer, then it will supply to right ventricle, and left to right vector should be produced. But the right ventricle is so small compared to left ventricle, the left ventricular mass is more, so the net direction of the vector won't change that much, so it won't cause the right axis deviation. But if right bundle branch block is combined with vesicular blocks, it will cause deviation. That is, this is the right bundle branch, this is the left bundle branch. The left bundle branch will divide into left anterior vesicle and left posterior vesicle. This is left posterior vesicle. So left anterior vesicle will supply the anterior part of the heart and lateral part of the heart. Left posterior vesicle will supply the inferior part of the heart and posterior part of the heart. So whenever there is a right bundle branch block plus left anterior vesicular block, whenever there is right bundle branch block with the left anterior vesicular block, only the left posterior vesicle will get activated. So inferior posterior part will be first activated. So if this is my heart, first inferior and posterior part is activated, then the anterior lateral part activated. So the wave will be generated like this, from down to up and from right to left. So the wave will be generated like this. It will cause the left axis deviation. If similarly the right bundle branch block is associated with left posterior vesicular block, then only left anterior vesicle will be activating. So left anterior vesicle will first activate the anterior part and lateral part. From there, the wave will be moving towards the right side and the inferior and posterior. So the wave will be generated like this. This is the wave. So it will cause right axis deviation.